get this guy's throat in though. Like, zoom in on that.
I would like everyone here to close his or her eyes and imagine a situation. You and your Grandpa Joe are at the zoo, observing animals. All of a sudden, while the monkeys are screeching, Grandpa Joe collapses while holding his chest. You drop to the ground to see if anything is happening to him, and you don't know what's going on. In a couple of minutes, Grandpa Joe dies, and there is something that you could have done to save him. So, what can you do in a circumstance like this? The answer is one simple acronym: CPR. CPR, also known as cardiopulmonary resuscitation, is an emergency medical process which you use on people who have cardiac arrest. Your main goal in CPR is to keep the victim alive until medical support can help you. In my speech today, I would like to teach you the basics of CPR, so if a situation like this arises, you will be prepared. The first step of CPR is to survey the scene. When you survey the scene, you need to make sure things are safe for both you and the victim. If you're on a road and there's cars passing by, you need to go onto a safer location so neither your victim nor you get injured. If your victim is in the water, you need to take him out of the water and on land so he does not drown, and so you're actually able to perform CPR on him. Once you know that the victim is in a safe place, you move on to the next step, which is check for responsiveness. To check for responsiveness, you should shake the victim lightly, call his name, and rub your knuckles on his chest. For example, if this was Grandpa Joe, we would go like, "Grandpa Joe, Grandpa Joe!" And he doesn't respond, so we need to move on to the next step. The next step is calling 911. When you call 911, you need to make sure that you give them as much information as possible so they are able to help you. You also should never hang up on the operator first, because if you do, they might not have all the information that they need to come to the rescue. Also, if there are other people around, you should have them call 911 and tell them what to do so you are able to move on to the next step more efficiently and quicker. The next 3 steps have an acronym known as CAB, or CAB. The first letter for that is C, and you do compressions. To do compressions, you put your hand out so you see your palm, and then you wrap it around your fingers. You locate the lower breastbone on the person and put your hands there. You need to do 30 compressions at a rate of 100 compressions per minute. The depth of the compression should be at least 2 inches. So if this was Grandpa Joe, this is what would happen. And you should also count aloud when you do it so you know what number you are at. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After you are completed with the compressions, you do the next part of CAB, which is A, airway. To check the airway, you should put your cheek against his mouth. When you do this, you feel for moisture on your cheek, listen for noises of breathing from his nose and mouth, and look for chest rises. So if this was Grandpa Joe, we would go like this, look for chest rises, feel for moisture, and listen for noise. The next step after that is to breathe into Grandpa Joe. To do this, you need to make sure the airway is not obstructed, and you need to put your finger underneath his chin so it's not clogged or anything. You should give the patient 2 breaths, and these breaths should be at a normal rate of what you are breathing about right now. So make sure you plug his nose also so air does not escape through the nasal passage. So if this was Grandpa Joe, it would go like, after you're completed with the breath part, you go back to compressions and you repeat compressions, breath, until the medical providers arrive. Every couple of minutes, you should check for the airway again with the moisture, noise, and rising technique. And hopefully you're able to save Grandpa Joe. Hopefully you have an idea of how to perform CPR now, and if a situation like Grandpa Joe's arises, you will be prepared. I encourage that you take a CPR class though, so you understand the basics of CPR even more and in depth. So, if you knew CPR, you would be able to give Grandpa Joe a chance of survival. If you knew CPR, you would be able to save a life.